Hello, I'm Maxine Lawrence, and I have the pleasure of being the Executive Director of the Good News Community Health Center, which was founded by Dr. Bob and his precious wife, Alice Sison. One of the things that Dr. Bob and his wife wanted to do is to bring excellent health care to individuals that otherwise would not be able to afford it.
When we first started, we were the only clinic here, and it was just before the recession of 2008 hit, and we were inundated. People were just losing jobs, losing insurance, and we prayed, Lord, this is your work to begin with, so may your people rise up for this community. And that's how we basically saw that the difference of this work is not that we're meeting the needs primarily of people, because there's always going to be needs. We serve Christ and we trust Him, and the whole idea is to glorify God in everything that we do, even in healthcare.
We want to give excellent health care. We want to give excellent mental health care. So physical, mental, and spiritual health care.
I enjoy working with Good News Community Health Center because it provides opportunities for folks that are having issues with substance abuse. It makes me feel good when they're able to have successes in their treatment goals.
I'm a family nurse practitioner, and so I'm a primary care provider here at the Good News Community Health Center, and my heart has always been with the most vulnerable in society, those that are homeless or immigrants, often people that are uninsured and don't have access to resources. When I walked in these doors, I just cried because I thought, I'm home. This is where Jesus wants me to be.
Sometimes she comes in with her dog, Bobby. Bobby is an excellent comfort dog.
We do provide care for people, take care of their medical problems, but the spiritual care is much needed, because if you treat the body, that means you treat only 1/3 of the problem. So you need to treat body, soul, and spirit.
It breaks my heart to see that individuals who want to recover from drug and alcohol use have struggles doing so.
So a lot of our patients come from under-resourced, underprivileged backgrounds, and what comes along with that often, the things that come along with that, obesity, addiction, depression, anxiety.
These are the people that I believe God has a huge heart for.
What drew me to the Good News Clinic was Dr. Bob and others' commitment to follow the Lord's leading and make it a reality for this community.
I remember one young man who came in now a couple years ago, and he was dealing with a lot of depression that was really affecting his ability to function. We spent a lot of time just talking and me listening. At the end of our conversation, I knew he probably needed some medication, but I also asked him where he found his strength, if he had a relationship with God, or if he was interested in talking about that. And he was interested in talking, and I asked him if he'd ever read the Psalms, and I gave him a Bible, and he came back a month later, and literally he was a different person.
Without God's people opening their resources and being good stewards, we would not be here.
I would encourage you that you are sowing into good ground. Your funds are going directly to support physical, spiritual, and mental care for the patients that come to the Good News Community Health Center. so much.